Hi, folks. We're going to go ahead and start up at the top of the hour here. We're just going to allow folks to fill in, and we will go live here in just a moment. Hello, my name is Mike Wett with the Intertribal Council of Michigan, and welcome to our webinar series, Advancing Health Equity in Native Communities. This webinar series aims to reach state and local health departments around the country to advance health equity and address social determinants of health among American Indian and Alaska Native communities. This webinar is titled Supporting Tribes of All Sizes, Ensuring Streamlined Funding Sources to Support Rural Tribal Communities. Your presenters today are Hannah Swartz, MPH, Program Manager for the Tribal Vaccine Equity Project and REACH here at the Intertribal Council of Michigan, and Laura Shepard, BSN RN, Community Health Director at the Perkins Family Clinic for the Iowa Tribe of Oklahoma. No commercial interest support was used to fund this activity. And at the conclusion of this activity, the healthcare team will be able to identify the need for equitable funding strategies and tools, identify potential challenges and barriers for creating equitable funding tools, and start planning and/or developing their own equitable funding tools. A post-webinar evaluation will be emailed within 24 hours after today's presentation. Please keep an eye out for it and let us know how we did. Also, if there are any questions, please go ahead and type your questions into the Q&A box. We'll reserve the last 10 minutes of today's hour for question and answers. Thank you very much. And now I will turn it over to Hannah Swartz.
Thanks, Mike. Hello, everyone. My name is Hannah Swartz, and I am the Tribal Vaccine Equity Project Program Manager with the Intertribal Council of Michigan. Today, we're hosting the last of our three-part series, our three-part webinar series that is technical support. As Mike said, it's called Advancing Health Equity for Native Communities, and this webinar series was made possible by the National Network of Public Health Institutes, or NNPHI as they're most commonly known as, to support local and state health departments who received the CDC OT 21-2103 grant. So today in our webinar, Supporting Tribes of All Sizes, Ensuring Streamlined Funding Sources to Support Rural Tribal Communities, it's our goal to provide you with a new perspective on how to support tribal communities through funding based on lessons learned, or lessons that Intertribal Council of Michigan has learned through not only this Tribal Vaccine Equity Project, but also our years of experience as a pass-through or a backbone funder. I see Mike is in the chat right now, so if you want to go ahead and introduce yourself with your name and organization, we'd love to hear from you and where you're coming from. But I will pass it over right now to Laura Shepard to do a quick introduction of herself.
Hi, good morning. My name is Laura Shepard, and I am a citizen of the Cherokee Nation of Oklahoma, and I am the Community Health Director for the Iowa Tribe of Oklahoma. And I've had the pleasure of working with the Intertribal Council of Michigan and Hannah on this project. We were an awardee of a sub-awardee of this, and so we were one of the small rural tribes that were able to benefit from this program. And so I'm happy to be alongside today and share our perspective and some of the strengths that work from this. Oklahoma is a little different, and so we'll share some more about we're not a reservation state, we're a tribal jurisdiction state. And so I can share some about that as well. But if you guys have any questions, please let me know, and I'm happy to be here and happy to share. Thank you, Hannah.
So we will go ahead and get started. As Mike mentioned, feel free to put any questions that you have in the chat. We'll try to answer them throughout the presentation, but if we don't get there, we will towards the end. So go ahead and answer any questions. So if you have attended any of our three-part series, this may be a little bit of review, but I do always like to give a background of Intertribal Council of Michigan. We are a 501c3 nonprofit organization, and we are a consortium of the 12 federally recognized tribes here in Michigan, and we are governed by a board of tribal chairpersons, and we are located in Sault Ste. Marie, Michigan, so all the way up on the border near Canada. And our organization was originally founded in 1968 out of financial necessity, which I think is really important as we talk about this topic today. So as a consortium of federally recognized tribes, we were able to generate a bit more funding for some of the needed programs to support tribal communities. Over the years, we've adapted in our organization. We've included many more departments and divisions, but we still do act as a forum for our tribes, and we're able to secure more funding so that they can do the work that is needed. So we advocate for our tribes in the development of programs and policies which improve economy, education, and quality of life for Michigan's Native Americans. And it is our mission to provide technical assistance to our member tribes and assist in the development of any tribal regulations, ordinances, and policies applicable to health and human services. So myself, I am a part of our health education and chronic disease division. And there are a number of different programs that we work on, ranging from cancer control and prevention to restoring purpose to traditional tobacco use and, reducing commercial tobacco use. We work on physical activity and nutrition, wellness. So we have a number of different programs, and then the one we'll be talking about today is vaccine equity. So a national program that Intertribal Council of Michigan administers is called the National Native Network. And what that is really a network of networks consisting of tribes, Indian, tribal, and urban organizations, and then other tribal serving organizations. And the main purpose of this program is to reduce commercial tobacco-related illnesses and cancer disparities among American Indian and Alaska Natives across the country. But really, having such great connections across the country, we've really become an information and resource sharing hub. And the Intertribal Council of Michigan was able to utilize that network to implement our tribal vaccine equity project. So I wanted to give a little bit of background on what that is. So late 2021, the National Network of Public Health Institutes, I get NNN and NNPHI mixed up sometimes. They had an RFP to build national infrastructure for mitigating COVID-19 within racial and ethnic minority communities. We were, Intertribal Council of Michigan was awarded in partnership with the National Native Network, and we were one of 5 or 6 awardees. I get that mixed up, but and we obviously serve American Indians and Alaska Natives, whereas the other awardees served different minority communities. And the goal of the project was to reduce COVID-19 vaccine hesitancy while also increasing access to COVID-19 vaccines and vaccine uptake. So I wanted to put in our website if anybody is interested in learning more about the project. So I'll put that in the chat, but in order to reach the goals of that project, Intertribal Council of Michigan's approach was to connect with tribal communities across the country through NNN's existing communication infrastructure to support training and technical assistance, as well as providing flexible monetary awards to support local vaccination efforts. So that's really the focus of today's presentation on how we provided those monetary awards. We provided awards to tribes who were supporting partnerships with community businesses and organizations to host either vaccine administration events where they could get shots in arms, or vaccine education events where they could address common concerns, or address hesitancy within their community. And then we also provided awards for tribes who are promoting COVID-19 vaccination education materials. So there's a lot of misinformation going on, and we had some vetted resources that we knew had factual information, so they could choose from any of those and put them up in their community as flyers or in their social media, any outreach that they had, so that they knew that they were providing factual information and that's what their community was seeing. And then another opportunity to be awarded funding was through healthcare provider trainings. So to build capacity within healthcare systems, we had some virtual trainings that providers could watch so that they could have better conversations with their patients who weren't sure about getting the vaccine or were hesitant, and how to assist them so they could make the most informed decision on vaccines as they could. So that was really our approach. We were offering funding for these 3 different areas, or 4, I guess, 4 different areas that tribes could implement. All right. So we didn't come upon this funding strategy. We didn't, oh gosh, what is the word that I'm trying to use? We didn't come up with this funding idea out of thin air. We really took some of the lessons that we learned from our work as a backbone agency over many years in Michigan and also across the nation. So a couple lessons learned that we have here are that there isn't always capacity for grant writing or grant management within smaller tribal organizations. They're really focusing on providing direct care to patients, offering community health programming, and tribal health systems don't always have a grant writer on staff or someone who has experience with managing grants, right? So ITCM has served in that capacity with federal, state, and philanthropic grants. So we do the writing, and then we provide subawards to tribes so that they can really do the work that's necessary within their community in a way that they know how to do it best. And something that we were hearing throughout the pandemic is just that we don't have the time to sit down and write a grant, right? There was just so much going on that to sit down and write a 20-page application was just not feasible. So we knew as a backbone organization that we could step in. Another lesson is that, ITCM has this long history of doing work like this, and administrative and reporting burden is real. So large funding or competitive funding causes barriers for smaller tribes to apply for funding, and acquiring grants, or once you acquire a grant, sorry, I'm getting all mixed up here, organizations will need to have a dedicated personnel and system to manage the finances of that grant. There's programmatic obligations like reporting, And for many of these direct service agencies, administrative and programmatic reporting becomes quite burdensome. You know, a lot of times when you're looking at funding, they're like, okay, what do I need to have done? And do I have the time right now? And do I have the staff to do that? So sometimes that can really even outweigh even applying for a grant. So we definitely took that into account when coming up with our funding strategy. And I think probably the most important lesson we've learned throughout all of these years is that tribes know their community best and they do good work. And as an organization, we honor and trust the rich knowledge and capacity of tribes to serve their people in their own way, right? So these are probably the top 3 lessons we've learned and how it shaped the work of the Tribal Vaccine Equity Project. So when we put out our funding, we did things a little bit differently, and we created a simplified and streamlined process. So I'll kind of go through what that process was, but when we put out our RFP, we required that interested applicants attend a pre-award webinar so that they could learn really what the funding was about, what opportunities there were. I know a lot of funders do that also, but it was a requirement that folks attended that, and you could watch it live or the recording. And then our application was a red cap survey, or I know a lot of people use Qualtrics, but something along those lines. So very simple. It wasn't a big long document that you had to fill out or type up. It was very short and to the point. And we also incorporated menu options where applicants could pick and choose what strategies they plan to implement. So if you remember back to a few slides, you could host a vaccine event where you're putting shots in arms. You could host an education event. You could host vaccine education materials in your community, or you could have a provider complete a training. So there was a multitude of different options, right? And you could choose one, you could choose all, you could choose some. So that was a little bit different than traditional funding streams. And I think one area that we were most interested in was describing your community and the vaccine climate at that time. It was part of our application because it was really important to understand and see our subawardees in their community and the unique context that they're operating in. So they could really have the chance to explain that, which I don't know is always weighed as importantly in traditional funding. So we chose our awardees based on their ability to reach the specific target population, so the unvaccinated folks, because of their unique position in and pre-existing access to that specific community. So it was more important to obtain that description of community than it was to understand this, maybe like the size of their organization, the history of receiving large funding. I know that's taken into account a lot of times when offering funding, but that was not something that we prioritized. And then we also didn't prioritize the technical qualifications of their staff, because we know that if you are embedded in your community and you're a trusted person, you're more likely to make an impact on someone's vaccine decisions or even just health decisions. So those were just a few of the different areas that we made flexible. And then another strategy in this funding approach that was provided or that we provided was a 2-part award. So we provided half the funding up front, where they received 50% of the funding upon award, and then another 50 once the final report was submitted. So that really allowed them to continue their vaccine outreach work, right? And this was mainly due to the short amount of time that we gave the tribes to implement some of their interventions. The overall project was 6 months, and then we had 2 months for tribes to really implement their strategies. So that was a little bit of that cause, but there has been other upfront funding models out there where you do provide the funding upfront. Let's see here. I will say setting up a funding opportunity in this way requires you as the funder to trust that your awardee knows how to serve their community best, right? You can't know, like, you may not know exactly what they're doing. You have to trust that they know how to do what's best in their community and that they will turn to you for support, but you don't have to know exactly every single detail in how they're getting to their end goal. You just have to know that they're meeting their goal, right? So. And the last piece of our project or our funding approach is the reporting process. And I know, Laura, you're going to talk about this a little bit more, but administrative and programmatic reporting is often difficult. I know for myself, working on federal grants, you have to have a login to a system like Grant Solutions or AMP or any of the number of platforms that are out there and work within that platform. And it can oftentimes be difficult and frustrating. So we wanted to make it as simple as possible and stay with that online survey. So we did, again, a red cap survey. We worked with our evaluators, which are Michigan Public Health Institute, to create this, and shout out to them. They were amazing to work with. And yeah, so we just focused on making a simpler reporting form. And then we also required the one-on-one interviews. So those were the 2 ways. And one thing that I thought was really nice and for tribes that were implementing multiple events, you could fill out a survey more than once. So it's not like they were waiting until the end of the project. Oh, what did I do all these months back, or weeks in our case? They could fill it out after each event, which I think keeps folks a little bit more organized. Let's see here. The outcome surveys really focused on the what and had that quantitative data and figured out what happened as a result of the program. And then the interviews were, structured, but they really gave the opportunity to explain how it happened, right? Through dialogue and that conversation. I also think it was a great opportunity to build trust in between your organization as a funder and the organization that you're working with. The reduction of really monitoring and asking for too many details, I guess, and reporting processes, it restructured some of the typical power dynamics. So a lot of times there's fear of reporting too much or not enough. And just having a candid conversation, I think, allowed some walls to come down and really give context to the work that was being done while sharing impact that was meaningful to the tribe, right? So you're not only reporting what's important to the funder, but what's important to the community that's being served. So those were a couple of the biggest flexible areas that we worked in. And I know we have a lot of time left, but I know Laura has a lot of great information to share. And before we get into that, I just want to say, we understand flexible funding strategies may not work in all situations, and you may not have this flexibility from your overall funder, but considering incorporating trust-based funding into your work can really advance equity in future funding opportunities, especially for smaller rural tribal communities who often get overlooked based on their size. So I hope you find a couple of these strategies helpful. And if you have any questions, please feel free to put them in the chat, but I will turn it over to Laura to talk about her experience with this type of funding model and any other information she has to share.
Thank you, Hannah. I am excited to be here today, and I'm grateful to get to share my experience and my opportunity with this. And I'm just going to kind of piggyback on a lot of the things that Hannah said and go back. So when she was on her lessons learned slide, she talked a little bit about the capacity for grant writing. And I think one of the things that happened, especially during COVID-19, was in our tribal communities, especially for small rural tribes, we were the mocks on the ground, right? So the boots in the community, we were going out, even as healthcare administrators, we were frontline testing, we were vaccinating, and a lot of our administrative tasks that we had normally done, like grant writing, grant reporting, administrative reporting, all of those burdens, in our tribal communities, they took a standstill because we prioritized our tribal members and the people in our community. So when we had an opportunity for a funding opportunity like this, where we could provide our providers with resources and professional development that they already need to have, and it was already established professional development on vaccine hesitancy, how to have conversations and motivational interviewing with our providers. We didn't have to recreate the wheel with this. It was already handed to us. And so the flexibility with the funding and how the Intertribal Council of Michigan understood that our capacity was limited during this time, especially in our rural communities where we didn't have staff to do those administrative tasks and those on the ground tasks. It really helped. Sometimes the administrative reporting can be a burden, and we have to weigh our options. Like, do we really want to write for this grant and this funding opportunity if it has such a restrictive reporting guideline, because we don't have the capacity to write all of those reports and then get them sent back to us for changes and then get them approved through our business committee and tribal administration and then rewrite them when we need to be providing services within the community then and there. So one of my favorite things about this was we had the data and the reports that we could do right after the event. We hosted a vaccine event. I went in and plugged in our numbers. I gave my brief description, and then I would have a Zoom session with Hannah and her partners, and I would explain, and that would be the storytelling aspect. So I could paint a bigger picture for her, because not all of that can be shared in data, right? So we could incorporate the data and the numbers along with the storytelling and the experiences. Because yes, we might have served this many people with vaccines, but we had this many options for education. And you know what, at our next events, those individuals came back with their family members, because just like Hannah was building trust with us, we were building trust with our patients and our tribal members in our community. So I like to call it like a circle of trust model. When your funder trusts you and knows that you are the expert in your community, you have those relationships established, it's a give and a take. You trust me, I trust you. There's not a fear mentality. I never felt a fear with my reporting on this like I do sometimes with traditional funding. Sometimes you have to write a report and it's a large report and you're like, am I sharing too much? Am I sharing too little? Am I going to be in Indian country is different than the rest of the world, right? And so do we really want to share this with them? And I felt comfortable enough in my discussions to share with Hannah and the team, like, hey, we were able to go out and have these conversations with our elders. And when we did it, you know, we brought them food or we brought them what they needed, because we're going to meet their need their physical need along with their need for knowledge. And that's how we build relationships in our community, and that's how we keep our community members safe and healthy. So that was one of the beauties of this project as well. Hannah treated us, and Hannah's team, they treated us like we were the experts in our community and that we knew our community best. So when we had a recommendation, I wasn't uncomfortable going and saying, hey, do you think we could do this? I knew incentives are big within our community. We like to share gifts and trade. And so right off the bat, I knew with our marketing campaign that we created, I knew that if we could provide some kind of incentive to individuals that we had conversations with, they would wear those marketing materials for us. And so we created a hashtag vaccination campaign. And when individuals came to get a COVID-19 vaccination, we provided them with educational materials, but we also provided them with a hashtag vaccination shirt. And it had the Iowa Tribe seal in the middle of the vaccination. And they wore those shirts proudly in the community. And it was a conversation starter where people started coming and knocking on our door asking for COVID vaccinations. And so with a lot of other funding opportunities, those incentivizing items can be limited, or we have to fight for those and justify them with a lot of justification, whereas the flexibility of the funding allowed us to prioritize what our community needed. And we knew that we would get farther and have higher numbers if we could provide this incentive. And from the beginning, we had the support through them. There's a lot of historical trauma in our communities with our tribes, and especially with our tribal elders. And so when working with our tribal elders, we want to ensure that we have the trust. And when we're sharing their stories with our funders, we want to make sure that, we have permissions to share that. And all along the way, our elders felt safe. They felt like this was a partnership and a relationship through all of it. And I think it was an opportunity for successes. And so through these partnerships, we were able to, a small rural community in Oklahoma. The Iowa Tribe of Oklahoma has around 900 tribal members. They're the second smallest tribe in Oklahoma. And we were able to provide over 10,000 COVID vaccines within our community. And so we vaccinated more than we have tribal members, but we were able to vaccinate the community in which our tribal members lived, descendants of our tribal members, other Native Americans that reside within our community. We have 2 universities within close proximity, and so we were able to do mass vaccination events and provide vaccinations to students. And at Langston University, at Oklahoma State University, we sent those students to our clinic to receive vaccine and testing. And with the partnership that we had and the flexibility of funding and the trusting relationships that we developed, we felt like we had ownership in the project. It wasn't like we were a worker bee. It was our project together, not their project and they're funding us. It was an inclusive project. I felt like I was a part of the tribal vaccine equity team, and anything that I had, I shared with Hannah as a resource to share with any of her other partners. And she did the same with me. And so it felt like a group effort. So we had ownership in that. And I think that provides you, when you have those relationships with your funder and fundee, it allows you to accomplish more and do more.
Laura, can I ask you, when you were looking at this application,
Mhm.
why was it important to you that we asked the describe your community, whereas traditional funding streams only look at like tribal membership?
Yeah, so within our community, as you can see on the map that's pulled up, this is our tribal jurisdiction or our service area. So where there's a tiny red star, and it's right by, right there. Yeah, that's our tribal complex area. And it's a tiny portion of the entire community. So one of the things that we have to do is describe communities within communities within communities. So when we have an opportunity to share, there's the Iowa community, and then there is the community in which they raise their children and their neighborhoods. And when we do this, we have the ability to serve all of the individuals, all of the Native American individuals, descendants, community members, and family that reside in that area. So when we were providing our vaccines, we always had Native preference in mind, but we know within the state of Oklahoma, we don't have traditional reservation areas. And so our kids go to school in the public school system. So if we did a vaccination event at the school to keep our Native students safe, we offered vaccines to all of the teachers. And we saw a huge success with that. So when we get to describe our community, sometimes we don't get to, we say we have over 900 or around 900 Iowa tribal members, but within this area, we may have 3,000 Native Americans that live within this service area. And then we may have 6,000 individuals that live in Native American homes, or 10,000 individuals because they may be married to a Native American, or their children may be Native. And so it allows us an opportunity to meet the needs of the entire family unit. And we don't get to count those numbers on like traditional grant applications when we apply for federal funding sources. It's hard to describe that. But when we can have a conversation and you say, describe the community and the individuals which you serve within the community, we say, you know, we are the Iowa Tribe of Oklahoma, and we have this many tribal members, and we serve the Iowa community, but we also serve Native and non-Native individuals residing within our community. And through that, it opens up to a massive number. And so when we don't have restriction on who we serve, because our business committee has allowed us to serve those individuals in our contracts and negotiations, we've negotiated that to meet the needs of our clients and keep our community healthy and our tribal members healthy. It allows us to meet the need of our tribal members so much more. But sometimes we can be limited on the funding that is available to us based on our tribal enrollment numbers. And
Right,
so
so
when we
with
had the
that,
opportunity to describe that, it opened us up
yeah,
for greater service. And so you'll see in all across Oklahoma, there's different areas where you might have a smaller tribal jurisdiction, but then you might be surrounded by other tribal nations, so you can have duplication of services in those areas. And we are very, very rurally located. So we are responsible for the Native Americans that live in this area. And so we may have to drive, we may have to take our mobile unit and go meet the patient where they are, or the tribal member or the community member where they are. And so that increases our burden. But then with not being able to apply for some of those funding sources because of lack of knowledge or understanding on federal funding side, we can't accomplish quite as much. But just like Angela and I had said in our quote here, don't look at the small numbers as limitations. Often they look at our size and they say, oh no, you can't accomplish this. But what makes us successful is, as healthcare administrators for small rural tribes, we see it on all aspects. So we're doing the reporting and the administrative side, but we're also seeing patients in our office on a daily basis. They're coming in and seeing us face to face. We're going into our community and we're hearing what people have to say. And because of our size, we see it as a strength. So small but mighty, we're able to do more. So it doesn't limit us, it makes us stronger. But a lot of funders don't understand that, and we don't have an opportunity to share that in a way. So you really have to get to know your communities and those that you're funding, because it may surprise you when you see yeah, they may have a smaller tribal enrollment, or they may have a smaller area, but who are they serving? Ask them. Who's their tribal leadership allowing them to serve? Where are they going? What are they doing? Because they may be doing more than you could ever imagine.
Exactly. I think that's such a good point. And I have another question for you, and I'm interested to hear from some of the attendees. So please put any questions that you might have. But as a tribal organization, and this grant is really meant to support state and local health departments. How can state and local health departments support you in a useful way? Like, what areas could they partner with you, or like what are some of the main ways that they could be of support when even beyond COVID? How could they do
Yeah.
that?
And so I have kind of an interesting perspective, because prior to I've worked in tribal healthcare for almost 10 years, but prior to that, I worked for the State Department of Health, Oklahoma State Department of Health. And so I understood a lot of what happened in the state and local health department areas. And so when I came in, I really focused on developing those partnerships and, working together, because there's a lot of things that you can do together as a team, and it meets the needs for the community as a whole. So sometimes the tribal community might be limited on the number of staff. So we may be able to host a vaccine clinic if we can partner with you and utilize like your nursing staff or your healthcare administration staff, and we'll help host that vaccine. We could provide the vaccines and you can provide the staff, and we can do it together in a partnership. We've done lots of mass vaccination events in that way. Having conversations and just meeting at a table and saying, hey, these are some things I can do. How can you help and support us in this way? Without just coming and saying, hey, we need this from you. Because it's a give and a take relationship. We all have the same goal in mind, disease prevention, health promotion. We may go about it in a different way. We may go about it in the native way. We may go about it in the Western way, but one of the things that you can do is do it together, because in the end, the patient is the priority in both aspects. We're trying to promote health, prevent disease, and there can be a lot of burdens or difficulties, especially with in our state, IHS with state and local health departments. Sometimes they don't communicate effectively back and forth through our electronic health record systems. And so if there is a STI, right now there's a big syphilis outbreak. One of the things that I've done is reached out to the Oklahoma State Department of Health and said, hey, if you have a positive case in this area, reach out to me. And one of the tribal partners will go with you out to look for these individuals if it's a positive HIV or positive syphilis, because we know our tribal communities, and we know sometimes there's a fear of showing up if you don't know exactly where they live or if they're off the grid. And Indian country's small, and we know where they are. We can help you find them, because we want to make sure that they're healthy and safe too. And so we're happy to partner in those ways. And I think building those relationships between your tribal and your state partners is very important. There's been difficulties with historical trauma and the way we've worked together in the past, but one of the things that we've done is really worked on repairing those relationships and having conversations, building those relationships, because it's really all I keep saying relationships, but it's really relational when you get down to it. Because when you have that trust, you're going to be willing to work together and serve the patients in the community as a whole. And so I think sometimes when we're provided with funding and we have really restricted reporting guidelines, or we have really restrictive budgets, or we have really restrictive administration type side of things, it's almost like, oh man, they don't even trust me. They don't think I can do this work. Do they really even know what we do on a day-to-day basis? And you don't. and we don't. And so when we can have a conversation and say, hey, we are already doing a lot of this. If you will trust us with this funding, we can do 10 times more with this. So we were already vaccinating a lot of our Native community. The funding that we received through Intertribal Council of Michigan allowed us to do so much more and make such a greater impact. And I remember emailing you and saying, are you sure that this is how simple it is? All we have to do is this, because during that time, our burden was so heavy with all of these. We received a lot of funding, but there were so many reports that came along with it. And this funding opportunity was one that really just allowed us to do the project immediately. We received half of the funding up front. We could do the project and then report, and that second round of funding created a streamline of sustainability. And we were able to use that to continue with what we were doing, so we didn't just have to end it cold turkey for our community members.
Yeah. And Laura, I want to back up to one thing that you were just talking about with health departments. And you keep talking about it's relational. It's about more than just reaching out when there's maybe a crisis at hand. How would a health department get in contact with a tribe like yours, and how can you have that connection and consistent presence so that so that both of you know what's going on? Is it coalition building, or what's the best way that they could do that?
Yeah, I mean, I think just getting involved, a lot of tribes will have coalitions, or they have, individual health directors, and they have individual program directors. I think if you can find a niche sometimes it's difficult to contact, I always say go through your tribal administration, but they receive so many emails on a day-to-day basis. If you just send a blanket email, and it's mass sent out to a lot of people, it's a lot less personal. And so sometimes when I receive those blanket emails, I'm like, yeah, I'm really not a priority to this person. I have a lot of emails coming through. I'm not going to prioritize this. But sending those individual email messages saying, hey, I really want to partner with you and figure out how we can work to better serve the community. So find out who the individuals are and reach out to them. Look on websites. A lot of them, we serve on coalitions. We serve on community events. Come to our powwow events, come to the ones that are open, and you're welcome to. Definitely come and show up and see what it's about. The more you show up and the more we see you and build relationships with you, participate in health fairs. We do a lot of health fairs for our community where we do blood pressure clinics and we do testing and provide resources. Our state health department has been really receptive to coming out to those events and participating. And that's where we meet face to face a lot. One of our tribal liaisons through the State Department of Health, when I worked at the health department, he was a health educator with me. I was a nurse and he was a health educator, and I built that relationship with him. And now he is a tribal liaison through the Oklahoma State Department of Health, and he came out and taught Tai Chi to our elders and helped build that relationship with our elders, and then was able to provide more health relations and build that relationship so that then we could say, hey, we really want to do more for you guys in this area, or we really want you to apply for this grant, or we really want to work with you on this. And then we could have a conversation and I can say, oh, really, that's a lot of reporting right now. We just don't have the capacity to do that. And they can say, oh, no, we can help with this side of things if you can help with this side of things. And so it's all boils down to conversation, trust, relationships, continuing to show up and meet people where they are, attending health fairs, attending powwows, coming to dinners or our Title VI programs where we serve our elders, volunteering, coming out, serving our elders, having conversations with elders. Those are all really good opportunities for our partners, state partners, to learn more about our community, learn more about our people, and to build relationships with us for partnership.
I think everything that you said is just so important in building relationships so that you can, you know, figure out what funding opportunities you could provide for tribes. So not just creating relationships won't just help the task at hand, but it could inform state and local health departments on, you know, different ways that tribes could receive funds or just even partner. So
Yeah, partners.
I,
Transportation is huge within our rural communities, getting individuals. A lot of our individuals really want to participate in some of our health classes or our exercise classes, our Tai Chi classes, our community garden projects. And our state partners will be like, well, we just can't get your individuals out here. Well, we have a lack of transportation. So having those conversations, you see where the burden lies. And sometimes you can work together and come up with solutions for those so that we can serve more individuals.
absolutely. Well, Laura, thank you so much for giving that presentation and really just explaining the need and again your experience with this funding stream. So we hope that we were able to provide some strategies and identify areas of need for funding tools like this. I know we've got about 10 minutes left, so I did want to leave time for questions. I'm not seeing any as of now, but if there's anybody out there who's looking to serve tribal communities, Laura here is a great source of information. So I urge you to go ahead and put that in the chat. But as we wait for a few of those questions, I did want to move to our page here where you can stay connected with the the National Native Network. And we've got our Facebook, our Twitter, LinkedIn, Instagram, and our website up at the top. As I mentioned at the beginning of this webinar, this is one of the three-part, or the last of the three-part webinar series supporting local and state health departments. If you want to go back and view any of those webinars that we've had throughout this series, you can find them on our keepitsacred.org website in the webinar archives. Mike put that in the chat, so there is a link there if you're interested in viewing those back. But if there's any other questions right now, it's the time to ask. I guess, Laura, if you have any last thoughts for the folks attending today, feel free to share those.
One of my other thoughts that just kind of popped into mind is a lot of times the state departments have resources, individuals that can create marketing campaigns or social media messages and things like that. And one of the things that you can definitely do is partner with the individual tribes on making those marketing messages more inclusive to their communities and their tribal members. So when you create a marketing campaign, whether it be on, some of them are on head lice, some of them are on vaccines, some of them are on car seat safety. You can make minor changes to those marketing campaigns or infographics. Specifically, if you use just the tribal nations colors or different things to make it feel more inclusive, that has been really great and really receptive. Just partnering with a tribe and even maybe putting the tribal seal if you can get partnerships and agreements from the tribe, or creating the document and then sharing it with the tribe to add on their tribal seal. A lot of times our tribal members or community members will trust things more when they come from the tribe, because that's their community and that's who they have the relationship with. And so if you can partner with your tribal communities on that, it can be really helpful in your marketing and media campaigns. So I just wanted to say that as well, because that was one of the great things about what we did too, is creating those marketing and media campaigns and then utilizing the resources through the vaccine equity program to share those resources within our community.
Absolutely. The more you can partner with tribes, the better you are going to be able to serve their communities. I did see one Q&A. So Laura, feel free to answer this as well. I'm getting pushback from my supervisor about having health fairs for tribes. She said health fairs are effective, not evidence-based. How can I convince her that it is effective?
So one of the things that we have used for our health fairs, as your health fairs are a tool. It's really hard to get evidence-based data to show that, hey, this individual walked away from this health fair with this knowledge base. But what we utilize our health fairs for is a relationship building opportunity, meeting your providers face to face. So we'll have providers come, community members come, and provide opportunities for talking circles, provide opportunities for question and answers, providing opportunities to have that knowledge base one-on-one experience. And within our tribal communities, even though sometimes it may not be evidence-based or they're looking for some kind of outcome from this, what I have seen is the numbers, like we keep record of the number of attendees from each of our health fairs, and we have individuals that return and come back. Then when we do those, we offer community health needs assessments and surveys, pre and post surveys. And the response that we've gotten is that they know that we are a trusted health resource. They know that they can come to us for information related specifically for these things. There is kind of like a fear and a knowledge deficit with reaching out to certain individuals. A lot of respect sometimes. They may not ask questions to a medical provider. They don't want to be a burden to them, or they don't want to take up too much of their time. But if you have like your community health workers, advocates within your tribal community attend the health fair with individuals, they can kind of help. We call them like nurse navigators or healthcare navigators, and they can navigate them through the process. And what we have seen is it increases. We have some data to show that it increases health literacy of the individual clients that participate in the health fair, because once they have those questions, and we can provide direct follow-up with, hey, do you understand what they're saying about your blood pressure medication or your water pill or your diabetes medications or your finger stick blood sugars? And then we do some follow-up teaching on that. So when you have a health fair, invite your community health workers, community health representatives from your tribal community to come and bring elders with them and help navigate them through the health fair, and then provide follow-up with them on that. And a lot of times that helps build a relationship. And then when they need health information from a trusted source, they'll say, hey, I remember that one time this community health department hosted that health fair, and I was with my community health representative, and I really learned a lot about this. I'm going to contact them and see if they can help me. But it'll also help build trust between the tribal communities you serve as well, because you're doing it through a partnership. So I hope that helped. And it's really hard. I've worked in the State Department as well, and I know that there is a lot of restrictions with funding on how we do things and how it has to be evidence-based. And what I always kind of advocate for is the patient is our priority. And so even if we don't know if it's evidence-based yet, how can we figure this out? What method of research can we do, or can we do trial and error to figure this out? And so I would encourage you just to keep pushing and coming up with justification reasons. And I hope some of what I said was helpful in advocating for that. And if you have any other questions, feel free to email me, and I can share a little bit about what we do at our health fair. So
Yeah, and I wanted to make sure to highlight some or our contact information here if you need that. And then I just saw in the chat, when you are innovative, evidence informed is great. So I think that's a great place to end. And I thank you for that comment. And coming to our webinar today, Mike, I don't know if you have any other wrap ups for us to end the presentation, but I just want to say a miigwech to Laura Shepherd for joining us today and her perspective and experience. And we thank you all for joining.
Thank you.
Yeah, once again, folks, we're going to go ahead and have this webinar archived. It will be available within the next 24 hours. And as well, I'll be sending out the post-webinar evaluation, and that'll also come from Zoom within the next 24 hours as well. So with that, we're at the top of the hour. It's just about 4 o'clock, so we'll go ahead and give everybody their time back. Thank you very much to Laura and Hannah for presenting today, and thank you to each and every one of you for attending as well. Thank you very much, and have yourselves a great day.